It is one of the most common cancers affecting women across the world, and yet one of the most misunderstood. Breast cancer doesn't discriminate by age, race, or even background. It affects mothers, daughters, sisters, and sometimes even the men. In this special report, we explore what breast cancer really is, how to detect it early, and why awareness can save lives. Breast cancer begins when abnormal cells in the breast start to grow uncontrollably. Over time, these cells can form a lump or mass and in some cases spread to other parts of the body.
Breast cancer is a kind of cancer because we have different kinds of cancer. There's lung cancer, there's ovarian cancer, and all that. So, breast cancer precisely is a kind of cancer that develops in the breast due to different cell changes in the breast. And these cell changes lead to what we call a tumor in the breast. And this tumor spreads. As we know, cancer spread, they don't stay one place, they like to multiply. But benign, that one, it can be like a lump-like structure in the breast, but it doesn't spread out, it just stays there. But cancer cells, they spread out and infect other normal cells in the human body.
Not all breast cancers are the same. The two most common types are ductal carcinoma, which begins in the milk duct, and lobular carcinoma, which starts in the glands that produce the milk. Each type behaves differently and requires a specific approach to treatment. That is why accurate diagnosis is so important. Understanding the type of cancer helps the doctors determine the right treatment path for every patient.
So the breast is a specialized gland. It is usually located on the chest of a woman or a man. So just to let you know that men also have breast as well. What is contained in the breast? The breast contains blood vessels, it contains nerves, and then it's made up of specialized structures that we call duct and then lobules. So the lobules are the structures in the breast that produce breast milk for a woman who is lactating, and then the duct collects the breast milk from the lobules and direct them to the nipple where the breast milk is let out of the breast. Another important component of the breast is the fat component. The size of a woman's breast is dependent on the amount of fat that is in the breast. Now, there are other normal differences that you may notice or people may notice in their breast. For example, there are some women that have something that we call axillary breast. Axillary breast is when you notice that apart from the two breasts that you have in front of you, you also have a small swelling that is towards the axillary tail and then towards the armpit area. We call that axillary breast. Axillary breasts are not particularly unusual, but they can cause problems in women, especially when the woman begins to lactate. Just to let you know that this can usually be handled surgically. So if you notice something like that, if you notice that you have another small swelling, which is like a breast that increases in size just when you are lactating, just like the normal breast, this is usually what we call axillary breast, and it can be sorted out surgically, and then you wouldn't have to have issues with it. Another anomaly that is common on the breast is what we call multiple nipples. So there are some people who have more than just two nipples on either breast. There are some people who have other nipples located on the chest wall away from the usual location of the nipple, as shown in this diagram. So these are also variants that can be seen in other people. Has many signs and symptoms that can emerge from the beginning. However, in this video, I'll only take you through some top 5 ones. So in no particular order, the first I want to mention is noticing a lump or a growth in a particular part of your body that did not exist previously. Often I'll get patients coming in who have noticed a lump growing either in their breasts, in their leg, somewhere in their head, or on their thigh somewhere. And most of them will ignore this for several years until they realize that it's too late. So if you notice something unusual growing in any part of your body that did not used to be there, and even more especially if you realize that this particular growth is constantly increasing in size, or it's been there for a long time and it's not decreasing in size, or it's not going away, then this deserves notice. So when it comes to specific cancers like breast cancer, we often ask the women to have a monthly habit of examining their breast. This will help you to be able to notice if there is any lump that is in the breast, and then you can report to your health provider as soon as possible. This is not for only breast alone. For any other part of your body, you need to know your body so that if anything unusual develops there, you can monitor it and report to your healthcare provider as soon as possible. The second sign and symptom I want to talk about is unexplained weight loss. It's a different thing when you hit the gym with the aim of burning down some fat and you realize that your weight is beginning to go down. For example, if you decide to go through a period of fasting, or if you decide to go through a period of dieting where you cut down your intake and you begin to notice that your weight is going down. However, if you realize that your weight is beginning to decrease, your weight is beginning to go down without any intention, without your diet changing, without you intentionally hitting the gym and doing something, this might be something of concern. It's not always, but it might be something that you want to check out or check it out with your healthcare provider. Another sign and symptom that I want to mention is bleeding. Bleeding from any of the orifices. Somebody can have bleed from their nostrils, people can have bleed from their penis, from their vagina. There can be bleeding from the ears, there can be bleeding from the mouth, unusual bleeding, unprovoked bleeding. Unprovoked means there has not been any activity that may have initiated or may have traumatized this part of the body. Meanwhile, you notice bleeding. This might be something that you want to check out with your healthcare provider. So another sign and symptom I want to talk about is chronic cough, or a cough that does not go away. It's one thing if you get a cold and then you cough for a few days and the cough goes away. However, if you notice that you are beginning to cough and this cough is getting worse, it's been weeks, it's been months, and the cough keeps getting worse and it's not going away, this might be something you want to check out with your healthcare provider. Because most of the patients that I see who present with diseases like tumors of the lungs, cancers of other parts of the body that has spread to the lungs, sometimes do have coughs that do not go away. So it might be something that you want to check out with your healthcare provider. Yes. Chronic fatigue. You just get tired. You have not had a hard day at work. You haven't gone to carry out some physical activity that warrants you being tired. But you've recently noticed that you are almost always very tired, as if somebody who has gone through a lot of work. It might be something that you want to check out with your healthcare provider to find out that there is nothing unusual about your system.
Breast cancer is classified into stages from 0 to 4, depending on how far it has spread. The earlier the stage, the better the chance of recovery. At stages 0 to 2, the cancer is usually still within the breast. By stage 4, it may have spread to organs like the lungs or the bones. Now, this is why early detection is very crucial. Also, regular checkup and screening can catch the disease long before the symptoms appear.
So first of all, what are the differences between grade and stage? Well, grading tells us how active the cells are and what they look like underneath the microscope. It can be used as a prognostic indicator where the lower the grade, the less aggressive the cancer is, as opposed to the higher the grade, the more aggressive that cancer can be. Staging, on the other hand, looks at whether the cancer has spread to other parts of the body. And this includes whether it's gone to the lymph nodes or surrounding structures, or whether it has traveled to distant parts of the body, such as the lung, the liver, the bones, or the brain. So let's go through this step by step. So as I've mentioned, grading can be used as a prognostic indicator. In breast cancer, there are normally 3 grades: grade 1, 2, and grade 3. Grade 1 being the least aggressive and grade 3 being the most aggressive. To understand a little bit better as to what grading is all about, we need to look at the basic building blocks of life, aka the cell. Cells are the basic structural and functional units of life, and you can only see them underneath a microscope. Within each cell, there are different organelles that carry out specific tasks. For example, the nucleus carries out cell division, or we also call mitosis, and mitochondria for respiration. There's also the cytoplasm that fills each cell and in which all these organelles are suspended in. Normal cells usually have uniform appearances and they are of similar size to their neighbours. They have a good cytoplasm to nucleus ratio as well. Cancer cells, on the other hand, behave quite differently. Their sizes can vary, the nucleus can be more pronounced, and the cells can be seen to be arranged in a very haphazard way. The more aggressive a cancer is, the more pronounced are these features. So in grade 1 cancer, the breast cells are more uniformly shaped with low mitotic activity, and the cells still look like breast cells. Grade 2, the cells start to vary in shape a little, and there is more activity in the cell division, and the cells are starting to adhere less to each other. And now in grade 3, there is variation in cell shape, there is high cell division activity, and the cells are becoming more varied in shape and are looking less like normal breast cells. On top of which, they are starting to climb on top of each other and they're losing their boundaries from one another. And these different features can be seen underneath a microscope, and that is how we grade how active these cells are. Staging, on the other hand, is quite different, and it normally describes the size of the cancer, but also whether it has spread to other parts of the body. Whilst grading can give us some prognostic indicators of the aggressiveness of the cancer, staging can help doctors decide whether local treatment is enough. For example, is surgery alone enough? Or whether systemic treatments such as chemotherapy or immunotherapy may be needed. Broadly speaking, there are 2 types of staging. There is the TNM system or the number system. Now let's talk about the TNM system. The TNM system stands for tumor node metastasis, and it's what doctors normally use formally. The T describes the size of the tumor, the N describes whether the cancer has spread to the lymph nodes or the lymph glands, and finally the M describes whether the cancer has spread beyond the lymph nodes to different parts of the body. The number staging system, I would say, is more popularly used amongst non-medics and is the one that most people are familiar with. You may know that there are 4 stages, so that's 1, 2, 3, and 4, and these stages apply to invasive cancer. For a non-invasive cancer, such as DCIS, this is called stage 0. This is the pre-invasive type of breast cancer, and the cancer cells are confined to the ducts of the breast and have not invaded the surrounding breast tissue. Stage 1 breast cancer means that the cancer is small and it's only found within the breast tissue, or it might be found in the lymph nodes close to the breast. This is an early stage breast cancer. Stage 2 breast cancer means that the cancer is either in the breast or in the nearby lymph nodes or both. And this is an early stage breast cancer as well, just like a stage 1 breast cancer. Stage 3 breast cancer means that the cancer has spread from the breast to the lymph nodes close to the breast, or it has spread to the skin of the breast or to the chest wall. And stage 3 breast cancer is also called locally advanced breast cancer. And lastly, stage 4 breast cancer means that the cancer has spread to other parts of the body. And you may hear this called advanced cancer or secondary breast cancer, or also known as metastatic breast cancer. These are the differences between grade and stage. Grade refers to how aggressive the cancer is, whilst stage tells us whether the cancer has spread to other parts of the body.
The beautiful thing here is, every woman's body is different, but certain warning signs should never be ignored. A lump in the breast or underarm, changes in breast size or shape, skin dimpling, nipple discharge or pain. All these are early indicators. Also note, not every lump is cancerous, but every lump deserves medical attention.
About a critical component when it comes to abnormalities that a woman can find in her breast. A common complaint is about finding a nodule or a lump in the breast. Now, any nodule or lump in the breast can be termed a tumor. Now, when we say a tumor, it does not necessarily mean that it is a cancer. A tumor is merely any form of swelling or any mass that is located that is not supposed to be at where it is found. It can be called a tumor, but it doesn't mean that it is a cancer. Most of the time when people notice that they have a tumor or a lump in their breast, they begin to panic. But one assurance I want to give you is that it's just about 10% of the lumps or the tumors that are found in the breast that at the end of the day turn out to be cancer. So what it means is that there's a high chance that that lump that you've noticed in your breast may not be cancerous after all. In as much as it's just about 10% of lumps that are cancerous, it's still very important that if you notice a lump in your breast, you follow up and get it checked out. Perhaps if it is something that requires urgent care, you can get the care early enough so that you prevent it from getting out of control or from getting advanced before it is diagnosed.
Doctors recommend that every woman should carry out regular breast self-examination, ideally a few days after their menstrual cycle ends.
Right, be honest with me. When was the last time you looked at your breasts in the mirror? And I mean really looked, not a quick glance in the mirror after a shower. Do you do it every time you check your breasts? Do you even know how to? Let's be honest, we're not told how to examine our breasts at school or by our doctors. Mum didn't tell me how to do it. I only learned at medical school. So why is any of this important? If you don't look in the mirror, you might miss an early sign of breast cancer, and the earlier it's caught, the better your chance of survival. And remember, men can get breast cancer too, so if you know one, make sure they check themselves as well. Right, you're in front of the mirror, topless. First, I'm going to tell you what to do, and then I'm going to tell you what to look for. So what do you do in front of the mirror? Well, first, you're going to stand with your hands by your side, and if you've taken your bra off, look at the inside of the cups. Is there any discharge there? What colour is it? Now, I want you to look at your breasts. Do they look the same? Many women think their breasts are identical, but they're actually sisters, not twins. One is always a bit bigger, maybe the nipple sits a bit lower, and it's completely normal for one breast to be a whole cup size bigger than the other, and for one nipple to be 5 centimetres lower. If you don't know what's normal for you, it'll be harder to tell if something has changed. Now, if you've got large breasts, lift them up so you can see the skin underneath the breast. Are your nipples inverted, meaning do they naturally poke in? That's normal too. Next, I want you to put your hands on your hips and push in. And what this does is tense your pectoral muscles, the muscles underneath your breasts, and look at your breasts again. Finally, as long as you don't have any shoulder pain, I want you to lift your arms into the air and look at your breasts for a third time. It should take less than a minute in total, but it's really important to do this. Now, although some women with breast cancer won't be able to see anything and they'll only feel a lump when they're lying down to check, some of you will notice a change before you feel a lump. And right, now I'm going to talk you through the changes you should be looking for. Let's start with your breasts. There are 4 things that you need to look for. Number 1 is a dimple or a puckering of the breast skin. Now, you may only see this when you put your hands on your hips or you lift your arms up, and it can be one of the earliest signs of breast cancer. Your breast tissue is connected to your chest wall by strands of connective tissue that run through to the skin. As a breast cancer grows, it constricts these strands, meaning that when the breast tissue is stretched, like putting your hands in the air, or when the chest wall muscles are tensed, like when you put your hands on your hips, that breast tissue is fixed in that spot. And that's why you see a dimple or a puckering in the skin, like someone, I'll show you, pinching in the material because that breast tissue is stuck. And that could be a really early sign of breast cancer. So now you know why I'm getting you to do your aerobics in the mirror. Number 2, a lump. But this is what I saw when I looked in the mirror back in 2015 when I was first diagnosed, and a couple of months ago when I had my second local recurrence. And I swear I didn't see those lumps the day before. You see, most breast cancers grow really slowly and they keep doubling in size until one day they are big enough to see and feel. A bit like a woman who is pregnant and suddenly her bump starts to show. You may see an obvious lump with your hands by your side, but it might only show when you move your arms around, and that's why the aerobics is so important. Number 3, a change in breast size or shape. Now for some of you, it's normal for your breasts to get bigger and smaller with your menstrual cycle. But if you suddenly notice that one breast is bigger than the other, or it's a different shape, that could be a sign of breast cancer. So it's really important to get that checked out. And finally, number 4, skin changes. Now your breast skin can become red and swollen with a simple infection like an abscess or mastitis if you're breastfeeding. You might have eczema on your breast or get an allergic reaction to a washing powder. But skin changes can also be a sign of breast cancer, particularly inflammatory breast cancer. And that's when the lymph vessels in the skin are flooded with breast cancer cells and they can cause changes. The skin can become red, hot and swollen, or it can look like cellulite or an orange peel. We actually call it peau d'orange. And that's why any skin changes in the breast need to be checked out. Now you've looked at the breasts, we're going to look at the nipples. And there are 3 things that you need to look for. And number 1, nipple discharge. This is completely normal. Think of it a bit like snot. Your nipples have lots of small holes that are connected to the milk ducts in your breasts, and just like your nose, the cells in those ducts produce secretions, and these can build up. And the colour of the secretions can change depending on the natural bacteria in your skin. Just as your snot can be cream or yellow or green in colour, so can nipple discharge, and it's completely normal. And if you have this discharge, don't squeeze your nipples, it just encourages them to make more. However, if the discharge is crystal clear, like water, or it's bloody, it could be a sign of breast cancer. So that needs to be checked out. And that's why it's important to look at the inside of your bra when you take it off, and also your nightie or your pyjamas, as the only clue might be a couple of spots on your clothes. Number 2 is nipple inversion. So some women naturally have nipples that stick in, called inverted nipples. Some have nipples that naturally stick out, and some, like me, have one of each. It's all completely normal. If your nipples are inverted, you should be able to pull them out, and they should stick up when you're cold or aroused. What isn't normal is a nipple that has suddenly become inverted and you can't pull it out. It's stuck. And that can happen if there's a breast cancer behind the nipple that's tethering it, like I described earlier with a skin dimple. If that happens to you, you need to get it checked out. And number 3, it's a nipple rash. Nipple rashes are common, again with things like eczema or an allergy to your washing powder. But some rashes are actually a type of breast cancer called Paget's disease, where the skin of the nipple is slowly destroyed by cancerous cells. So if you notice a new rash on your nipple, you need to get it checked out just in case. And finally, you need to look at your armpits when you have your hands in the air. You might notice a new lump or swelling that hasn't been there before. Now, this could simply be an enlarged lymph node, and there are lots of reasons why that might happen, such as a bad chest infection. But it could be due to something more serious, like a breast cancer or a blood cancer. So, again, if you do notice a lump in your armpit, get it checked out. And remember, if you're still having periods, do it in the middle of your menstrual cycle when your breasts are less lumpy and sore. And now for the bonus section. What are the 3 biggest mistakes women make when checking their breasts? Number 1, not looking in the mirror, digging in with your fingertips. If you do this, then your breasts will feel full of lumps because breast tissue is like a mixture of sweet corn and jelly. It's naturally lumpy, especially when you're young and especially in the upper outer quadrant near your armpit. Normal ridges of breast tissue are felt going out from the nipple to the armpit. When you feel them, it can be really scary. And then you feel the ribs underneath the breast tissue and you can start to panic. I know, I've been there. Instead, you need to feel your breasts like a breast surgeon does, and when you use the flat of your fingers and you firmly push your breast tissue against your rib cage to see if you can feel a lump. No more digging. Now, number 2, you should be lying at about 30 degrees. So like this, either lying on a couple of pillows or lying back in the bath. The only people who can get away with doing it standing up are men and women with small breasts that don't droop. There's no nice way to say drooping. The technical term is ptosis, but you know what I mean. If you have large breasts and you feel them standing up, the breast tissue is doubled up, and that means it's much harder to feel a lump in the lower half of your breast. By lying back, your breast tissue is lifted onto your chest wall, where it's much easier to feel. And if your breasts are particularly large, you might need to roll onto your side, and that just helps lift that breast tissue onto the chest wall so it's easier to feel. And the third biggest mistake that you often see in videos online is don't examine your armpit with your hand in the air. Now, why do I say that? When your hand is in the air, your armpit skin is stretched and it's tense, and there's no way you're going to feel lymph nodes deep inside. You need your armpit to be relaxed. So, rest your hand on the opposite shoulder and feel with the other hand, starting at the level of your hairline and moving your hand up. And you're pushing in with the flat of your hand to see if you can feel any enlarged lymph nodes like small marbles.
While self-exams are important, they do not replace professional screening or mammograms, which remains the gold standard for early detection. Let's talk about risk factors. Some risk factors cannot really be changed, such as age or family history. But these are not the only risk factors. Let's find out other risk factors that can be changed.
One question I've often been asked is what causes breast cancer? It is not yet known what causes breast cancer. However, we know there are certain risk factors that can increase one's chances of developing breast cancer. Topmost on the list is being female. It's just about 1% of breast cancers that are diagnosed in males. This means that by being a female alone, your risk of developing breast cancer is high. After being female, another common risk factor is increasing age. As a woman grows older, her risk of developing breast cancer increases. Few patients are diagnosed less than 30 years. However, it is important for me to mention that we have diagnosed people, or we have seen people who are diagnosed of breast cancer at the age of 20 years. So even though it's uncommon in that age group, it is still possible. Now, going forward, we do realize that as a woman grows older, her risk of developing breast cancer increases. The risk of developing breast cancer, however, begins to decrease after the age of 80 years and above. Most of the patients that we see in the clinic are between the ages of 40 up to 50 years. But breast cancer is common along all these spectrums, as I mentioned earlier on. Another important risk factor is a personal history of breast cancer. Someone who has been diagnosed of breast cancer before has a high risk of developing breast cancer again. So what that means is that if you have gone through treatment for breast cancer, you have to be on the lookout and then examine your breast periodically so that if you notice any unusual lumps, they can be attended to quickly enough. Apart from personal history, somebody who has a family history of breast cancer, the higher the number of first-degree relatives you have with breast cancer, the higher your chances of developing breast cancer. More so, apart from breast cancer history, if you have a family history of ovarian cancer, pancreatic cancer, prostate cancer, then you should know that your risk of developing breast cancer is high. Apart from family history of breast cancer, there are certain genes that can be passed on from generation to generation. Common among some of these genes is what we call the BRCA1 and BRCA2 mutations. These genes increases one's chances of developing breast cancer sharply compared to the general population. Another important risk factor when it comes to breast cancer is late age at childbirth. There's a case control study by McMahon et al. That did find that when a woman gives birth to her first child between the ages of 20 and 25, her relative risk of developing breast cancer is decreased by about 50% compared to the woman who has not given birth before in her lifetime. Now, a very interesting thing to note in this particular study was that when a woman waits to give birth after age 35, her risk of developing breast cancer is actually higher than a woman who has never given birth before. So it's very critical to know that the age at which a woman gives birth is very important when it comes to her risk, whether increased or decreased in terms of the development of breast cancer. How early a woman begins her menstrual cycle, something we call menarche, and the age at which she enters menopause are relevant when it comes to the risk of developing breast cancer. This is related to the exposure of a hormone we call estrogen. Now, the breast is actually under control of a hormone we call estrogen. Estrogen is produced by the ovaries, and anytime a woman has a menses, the ovaries produce and release the hormone called estrogen into the blood. This estrogen has effect on the breast tissues. So when a woman has a menstrual cycle earlier in life, it means the exposure to estrogen begins very early in life. And then when she delays in entering menopause, what it means is that she has had a very long period of her lifetime during which her breast is under the constant exposure to estrogen. These have been found to increase the risk of developing breast cancer. So early menarche and then late menopause are also important risk factors when it comes to the development of breast cancer. Exposure to radiation. There are some people who have been treated for certain cancers earlier on in their life, usually around the ages of 20. In cases where people were treated for lymphomas, they did have radiation treatment. Such people have been noticed to have a higher risk of developing breast cancer, especially if their breasts were exposed to radiation at these early ages in life. So previous exposure to radiation in some women is a common risk factor when it comes to the development of breast cancer. Another common risk factor we've noticed that pertains to breast cancer is obesity. So we do notice that women who are obese tend to have a higher risk of developing breast cancer compared to the women who have a normal body mass index. There are also some women who use estrogen replacement pills after menopause. In fact, using estrogen replacement pills means the woman prolongs the period for which her breast is under the exposure of estrogen. This has also been found to increase the risk of developing breast cancer. Alcohol and smoking are common risk factors. In fact, alcohol generally has been associated with many cancers, and then breast cancer has also been found to have its risk increase for people who are known to chronically consume alcohol. Tobacco contains certain substances that we call carcinogens, and these carcinogens, when somebody is exposed to them for a very long period of time, tends to increase their risk of developing cancer, and breast cancer is one of these as well.
I'm Sandhya Bihani, and I'm 57 years old. I'm mother of two, a daughter and a son. January of 2019 is when I was diagnosed with breast cancer. I had my surgery, a lumpectomy. I also went through chemo. After that, I had my radiation. And now I'm going through my Herceptin infusion, which will be for at least a year. I was a person who was very reluctant on having my mammograms. My OBGYN would say, oh, annual mammograms, routine. I have no history of breast cancer in my family. And I said, okay, before I go see my OBGYN, I'm going to have my mammogram done. I went for my mammogram, and in my routine mammogram test, they found it, and then they recommended biopsy, and that's how they found it. It was stage 1 HER2 positive breast cancer. Breast cancer, this journey and all that Mayo has to offer, the coffee and conversation, the one that Susan Cain organizes for breast cancer patients, which is once a month at Mayo Clinic. To me, that is very important because there are subjects or information that's shared during those conversations is very relevant to what I'm going through as a cancer patient. There are a lot of experts or doctors or care providers who come and speak or share their knowledge and experience is something that I'm looking firsthand. So instead of going and buying a book or trying to read online and not knowing if I'm getting the correct information, coming here once a month, being with others who are going through similar breast cancer or other cancer treatment like I am, being surrounded by them and sharing our experience, laughing, talking, along with a cup of coffee, and at the same time getting all the information that is pertinent to my treatment or something I may have missed, I may have not even known. All that information that they provide is vital, and I look forward every month coming and being part of this Coffee with Conversation. My motto is attitude with gratitude. If you have the right attitude and at the same time having gratitude for all the people, everybody, professionals, your family, friends, who are helping you in this journey, to appreciate them and be thankful for everything that you have. The future looks so bright. The future is awesome because I know I'm in the right place. I've got the right treatment. Everything is falling in place. So we look forward to seeing every stage in our life with a lot of love and enjoy every moment that we have.
Doctors emphasize that awareness, early testing, and lifestyle choices play a powerful role in prevention and recovery. Around the world, more women are surviving breast cancer today than ever before, thanks to early detection and improved treatment. But awareness remains the first and most vital step. Get screened, encourage someone you love, because every early diagnosis is another chance at life. This has been a special report on breast cancer awareness. I am Emedion James.